Welcome back, everyone. And today's episode's very exciting because we have a special guest. His name is Dr. Rosselli, DO. He's the founder of Revital IV, Florida's premier IV vitamin and bioidentical hormone center. He's also chief of anesthesiology and chief of surgery at Jupiter Medical Center. And he's board certified in anesthesiology, a member of American Academy of Anti-Aging, and certified in non-surgical facial rejuvenation. Thanks for joining us, Dr. Rosselli.
Thank you very much for the invite. The word anesthesiology is always difficult to say. I've been saying it for 30 years and I still get it wrong sometimes.
It's a killer. It's a killer. And it's also a word that fortunately none of us have to say too often. We don't want to go down that path unless we absolutely have to. So thanks for giving me a little bit of a break there on that pronunciation. Let me just share how this came about. I went to your clinic, a couple of months ago and was really impressed with what was happening at the clinic and excited to see a clinic such as yours. And I had a IV vitamin C treatment and found the whole experience very positive. So I click on all of the emails that come through from your clinic, which I must say I don't do for many emails that I'm on as part of, the bulk distribution. And you were, or your staff were promoting a set of supplements that were very affordable and exactly the same set of supplements that a board or a panel of rheumatologists had been recommending for people with autoimmune conditions who I interviewed only a few weeks ago. And so the match for me was perfect. And I thought, what a great opportunity while surgery is paused over at the hospital to see if I could have you on board and take this opportunity to hear about these supplements in detail, because it's one thing to know we should take zinc, for example, but it's altogether another is to understand why and feel like we're actually learning in this process of getting well and being healthy, as opposed to just being, a customer of Amazon and buying stuff all the time.
Well, being an educated person is important.
Most definitely. And it sort of makes the whole process of trying to get well more, I guess, interesting and feel like you're more empowered. So with that background, I then was delighted to be able to have you on this show. And you've got 2 decades of experience as an anesthesiologist. So what inspired you to take the entrepreneurial step and open a clinic such as this?
Well, being an anesthesiologist, we use IV therapy, every day for every patient. Either it be blood products, regular fluids. So it was something that I've learned over the last 25 years that I feel very comfortable doing. So my background, I've always liked the wellness. So it's a combination of being an anesthesiologist and understanding hydration in a person, balancing their amino acids, balancing their vitamins, and putting the part of anesthesiology that I do with the wellness side that I've learned being a physician. That is, I thought it'd be a good combination in this area of Florida, because, people are dehydrated, people don't eat well, there's obesity, there's diabetes, there's all the types of diseases that we all know are around. So I try to put, two types of medicine together and put a wellness center that is able to do both. So say for instance, if you don't like IV therapy and you're scared of needles, I have other ways to treat your vitamin D, help you with your diabetes and, all other types of medical issues that you might have that I can probably help you with.
Not to create a stereotype here, but it's quite unusual to have someone of a very high level medical profession also have even a passion, let alone a deep knowledge about alternative or complementary therapies. Typically, one who becomes right at the top of the hierarchical echelon, as you have become as chief of surgery at a major prestigious, one of the best hospitals in Florida, to have this interest as well. So have you always had a passion or a personal interest in wellness, or is it something that you came to sort of learn more about because of a need, because you're seeing patients doing such fundamentally wrong things?
I would say it's a combination of both things you just said. When I was 30 years old, I pretty much wasn't into wellness. When everybody's 30, you'll feel great. You don't feel like you need to lose weight or watch what you're eating because we're invincible. But as you get older, my wife and I, we were very big into fitness. She had irritable bowel syndrome and some other issues with her GI tract, and that triggered me to start learning these things. And when we got into our 40s, we both had hormone issues, and that triggered us to learn about hormones. So it was more of an evolution of my needs and things that I've learned, like say in a conference. And it triggered me to say, wow, I think there's a place for this. I don't think this is more alternative medicine anymore. I think this is becoming more mainstream because, hormone replacement therapy, the old adage is, 50 is the new 30. It really is true. And if you look at pictures of your grandparents or your parents at your age, if you're taking care of yourself appropriately, you really don't look like they did. So I think we might not be extending our life, but we're having a better quality of life because we're able to manipulate things in our body that we have the opportunity to manipulate. And I think that's the big difference in our age group going forward. And I just can't imagine my children who are in their 20s, how it's going to be for them later. What we're doing is going to be prehistoric to me. And it's going to be like, the Jetsons where you have, you just take a pill and everything's perfect and you balance everything out. So it's kind of fun being on the forefront of this because I see it evolving, not just monthly, but like daily. There's always something new coming out.
Yeah, definitely the forefront, as you said, because I reckon some of our listeners are still wondering, well, what exactly is this clinic? So for those people who are new to this, can you just describe what is a hydration clinic and what happens as a customer when people come to your clinic?
Okay, so in basics for it, it's an IV vitamin therapy center. So for instance, if you come in and you say today, doc, I'm not feeling that good. I've had a little bit of GI bug. I have a vitamin treatment for that. I'm trying to keep my immune system up. Everybody's worried about the COVID virus. I have an IV to help you keep your immune system up. I don't promote hangovers, but I have a hangover treatment if you come in hangover. So I have like 6 or 7 different IV treatments for certain types of people or certain types of conditions. But then if you came to me again and say, you know what, doc, I want to check my lab work and I want to see what my micronutrient panel is. So it comes back and says you're missing B5, B6, glutathione, vitamin C, oleic acid. Then I can make my IV to you, and that'd be your bag when you come in every time instead of getting a generic bag that's on a menu.
That's phenomenal. And I didn't know that. So when I came in,
I looked at the menu.
I came in and, like literally the menu, and I was conservative and I just went with what I have become very familiar with, which is just IV high dose vitamin C. And I thought, this is my first experience as a customer of the IV treatment. And I just wanted to take a small step, but I wanted to know what it's like because there's one paper published out in New Zealand where a lady had very high inflammation with rheumatoid arthritis, and she took a IV treatment of vitamin C, and all her symptoms disappeared. And that was very fascinating to me. And that was published in the medical literature. And so I thought, I'm going to go and try this and see if it's something that people, in our audience might be interested in trying. So I had a good experience with it. Also from a pre-surgical viewpoint, because I was approaching a surgical procedure. What other? Maybe you'd like to talk to the just some of the benefits, including the ones that I've just mentioned, if you'd like.
Well, when we do a pre and post surgical IV, I try to put in a higher dose vitamin C and B vitamins, which will help, like give almost a neuroprotective effect or a neuromodulating effect. High dose vitamin C is antihistamine. So when I deliver anesthetic, usually when you come, you're not eating and you're not drinking for, after midnight. So when you come in, you're dehydrated, your carbohydrate load is down. So I give the day before an IV that will help keep your fluids up. It helps a lot. It helps with nausea. It helps with almost the hangover effect from anesthesia, which I see a lot. And when they come in 2 or 3 days later, post-op, I give them a similar IV, and they do better from that. I mean, even small things that are evolving from IV therapy for surgery is just, for instance, up until the last year, we're giving patients a Gatorade, a bottle of Gatorade 4 hours before anesthesia. And that's a similar process of getting carbohydrates into a patient and giving them some type of fluid intake. Gatorade is, what is it, 6 ounces, 12 ounces. So it's really not a lot, but it does make a difference. So when I give my pre-surgical IV, it's usually a liter of fluid, and people do a lot better that way.
Mm. Are there any other benefits that we should know before we move forward from vitamin C? Because I imagine it's one of your most popular treatments that you have. So I don't think the average person walking in is thinking of it like we just talked about, and I was, with regard pre-surgery. So what do you think motivates most people to get the vitamin C treatment?
I think it's more word of mouth, because people have learned over the years, like you watch TV and you see Emergen-C and all these other medications that supplements people take over. So vitamin C is almost like a household name. So just also since people are taking the vitamin C all the time, they see a Myers cocktail, and a lot of people know what a Myers cocktail is because it's from someone named Dr. Myers, who was an emergency room physician who made what they called a banana bag, and it was yellow from the B vitamins, and he gave that to patients that had issues. So that's a common thing, and in the combination of the vitamin C and the Myers, that's what people come in asking for. So when you came in, you might have got a Myers, because sometimes people get a recognition of that word, and that's the most common one. So the vitamin C, people like it because they all think it helps with colds and things, which it does, but it lessens pain after injuries. Like I said before, it has antihistamine effect, antioxidant effect. Patients that have, like you mentioned before, autoimmune diseases, it does help because it decreases the inflammatory effects in their body. So a patient could have a C-reactive protein, which is your inflammatory marker, of like 15, and they can get a high dose vitamin C and get it down to levels where it's acceptable. It's temporary, but it keeps their inflammatory process lower. They have environmental reasons. We have We have genetic reasons for autoimmune diseases, but there are some things that we can control. And one of the big one is our diet, what we put in our body, and supplementation to help decrease the inflammatory effects.
Yeah, it's very safe, isn't it? Because people want to worry about these high doses who don't really know the research, but the research is there that, as far as I'm aware, certainly by oral standards, the only side effect is loose bowels.
Right.
But in terms of IV, I mean, you're talking an order of magnitude. If you're taking 2.5 say you're taking 2-3 grams a day orally, with the IV treatment, it can go up to 25-30 grams, can't it?
A normal Myers cocktail has like maybe 5 grams, but one of my newer ones called the Resist has 20 grams. Patients that have cancer, that are on cancer treatments, they like to come in. I give them up to 50 grams.
Oh, wow. Okay. Yeah.
The 50 grams takes a while. It takes about 2 hours, 2 to 3 hours, because it's not something you can do fast, but it does make a difference.
Yeah. Yeah. Well, next time I go in, I'm going to get what seems to be the hottest and most trendiest supplement at the moment, being talked about a lot in anti-aging forums and in just autoimmune sort of stabilizing groups, which is glutathione. It's something that, whilst is building, in its awareness in the public, is still something that I would say that most people don't have a lot of understanding around. So I'd love you to explain a little bit about glutathione, just real basics to begin with, and then going from there as to why it might be beneficial to add it to either a hydration therapy like you do, or in a supplement form, to loop back to the earlier point that I made, that you have a set of supplementation form of these products, which is an offer as well. So love to hear about glutathione.
Glutathione is my favorite thing. It's my favorite IV medication or PO medication that we have. To me, it's just amazing. It's the most powerful antioxidant in the body. It's usually from our diet, but our diet doesn't have much of it. It's high in avocados and certain other vegetables, but in our regular diet, it's not prevalent enough. What I like about it is, besides its anti-aging process, detoxifies the liver. So it really actually cleans your liver out. So if you came in for the first time and you had glutathione, you might call me the next day, say I had a little bit of a headache, or I just didn't feel that great. It's because the liver is releasing all the toxins from the glutathione. So if you came in again, you most likely wouldn't have that issue. A lot of people like it for the anti-aging because it's great for the skin. In certain cultures, I know in Asia, people use it in a cream to help lighten their skin. So women or men that have melasma, where they have a black circle around here as they get older, people come in for those treatments once a week to get the melasma and the skin lightening to come out. So it's pretty helpful. Taking glutathione by mouth really doesn't work. We also have like a sublingual spray, which it's something just like this. You just spray it under your tongue about 4 or 5 times a day. And I just, if you're sick or you're trying to prevent getting sick, like we are trying to do today, these are one of the things I always recommend to do. And that's also like in my immune boosting packet that I do besides, vitamin C, glutathione, zinc. Those are things that I think are most beneficial to I just love glutathione. I can talk about it for, it's just my favorite.
And I believe that the glutathione is actually an antioxidant that exists within our cells, isn't it? So yes. Unlike other antioxidants that we think of, like if we were just to apply real common knowledge of antioxidants, people might think of, say, berries, where we can eat some berries and we know that the antioxidants can fight free radicals in the body. But if our diet isn't sufficient in these antioxidants, or in the case of an autoimmune disease, the body's efforts in reducing the pathogens that it perceives, which happens to be its own tissues, creates more free radicals in the process of doing so. So the autoimmune process is very, very free radical creating. And therefore, the studies show that people with autoimmune diseases are actually low on these things. They're low on glutathione, they're low on catalase, another cellular antioxidant. They're low on all of the dietary antioxidants that, you mentioned vitamin C, vitamin D. And so it's not because even with a great diet, that their intake is too low dietarily. It's that the body just draws down on all of these antioxidants because they're creating so much free radicals. So there's a great argument to try and boost these from a cellular level with something like glutathione.
It's funny the way you're describing it is two types of people. There's people like you and me that understand this, and we're promoting our lives to better health and wellness, getting rid of antioxidants. And then there's another faction of people that are eating fast foods and foods that just don't have these nutrients in it. So it's almost separating classes from people that don't know about this and are not eating well compared to the people like you and me. And it's kind of sad because, that's why I want to get my message out, not just for entrepreneurial effects. It's just because I really believe that we really can help with obesity. We can get rid of I guarantee we can get rid of half of diabetes. Half. And diabetes leads to dementia, diabetes leads to vascular disease and so many other issues that, if we nip this in the bud now, and this right now, there's no silver lining to me to this COVID crisis, but if there is a slightest bit, is that maybe we're eating better at home. We're cooking more. We're not going out. We're giving ourselves the opportunity to almost to reset and re-find ourselves and what's important. I'm looking out my window for a second and my son's outside working out. My daughter's doing her yoga outside right now. So it's kind of like we're resetting ourselves to maybe finding what our body needs instead of, the extraneous things that we do every day to make ourselves happy.
Yeah, absolutely. We also take the opportunity to exercise during the day. I just actually finished up just before I sat down with you here. Was out at the little gazebo across the road here doing my yoga. We get the kids out twice a day, and just as a family too, it's there are opportunities to reconnect on the family level as well. So completely agree. Look, it's hard to find a silver lining in such a horrible situation, but we do our best. So continuing on our discovery here of these powerful supplements or IV treatments, and going back to this list that the rheumatologists recommended for people with autoimmune diseases, again, the exact blueprint that you have as your offering here, which made me so excited to talk to you. We've spoken about vitamin C. We've spoken about glutathione. The other three are zinc, NAC, and vitamin D. So I'd like us to go through those one at a time in any order that you'd like, and just talk about the importance of these particular nutrients and how they impact the body.
Don't forget, almost all the supplements that we're talking about, amino acids, branched chain amino acids, they're all integral parts of our metabolism, our immune function. So if one of them is missing, then if you're missing a spark plug in your car is not going to run appropriately. If you're missing a certain type of something in your keyboard, if you're missing one letter in your keyboard, something's not going to work. So that's what happens in the body. If we don't have enough zinc. Zinc is so important for immune health. That's why during this crisis, zinc has been very helpful, because zinc is supposed to break down a part of the coronavirus membrane. I might not be saying it correctly, but that's why they recommend making sure everybody has zinc. So in almost every IV, I put in zinc no matter what, unless somebody has an allergy, just to say I want to make sure they get the appropriate things. So it also can help. It can help a regular cold. Zinc. It can help with viruses, like people get cold sores. So it breaks down certain areas of the virus chain, and that helps break the length of time the virus can stay. So that's why it's important. Again, zinc is in our you think you really can't hurt to have more zinc in your diet.
Yeah, for sure. And it's something that I've actually neglected over the years. It's not something that I've paid much attention to, but it's been interesting to see it come up so frequently in conversations during COVID.
But if you look at your multivitamin, which most people that listen to this probably take a multivitamin, I'm not a big fan of multivitamins because the amount that they put in there is so small. It'll say 42% of the FDA amount, but even the FDA amount isn't enough. So I don't want people to get complacent thinking, "Wow, I take a multivitamin and vitamin C is in there, and zinc's in there, and D's in there, and NAC in there." But you just have to make sure it's to the numbers that you need. So that's just research on people's parts, and it's fun research anyway, just to find the right dosages that will be good for you for a dietary supplement.
For sure. I like the word fun here, because we're going to get into N-acetylcysteine or NAC. Now, I've never had anyone on the show ever talk about this. So this is fun for me, because it's one of these supplements that I started taking. I was diagnosed with rheumatoid arthritis nearly 14 years ago. And I think I had an entire drawer in my apartment full of supplements. And I didn't even know what they were. I was just buying. If you found one internet post somewhere that someone said they took this supplement and it helped them, we bought it. Okay, so right. So tell us about the non-madness and the justification for NAC.
NAC, like you said, is again another one of my favorites. It's a part of the a chain of metabolism and energy production in the body. NAC, NAD. So it helps relieve symptoms like respiratory conditions. It helps with expectorant if you have an upper respiratory tract infection. Loosens mucus in your passageways. Again, it's a powerful antioxidant, so that's why we use it. It has anti-aging properties. Anything like glutathione that cleans out the liver. Detoxes, that's almost where we get the anti-aging effects from. So NAC, glutathione, it cleans the liver out, gives our body to get rid of the free radicals, all the junk that we put now into our liver, alcohol, all the things that gets bogged down in our liver. It helps get rid of those antioxidants.
Okay. Yeah.
So I like it. We don't have that in an IV. We have NAD in an IV, but we don't have NAC in an IV, and that's usually can be taken by a supplement. But again, it's important to find the right supplement. Like you said, you can have a drawer full of things, but you got to make sure they're gluten-free, no fillers and things like that. So that's very important also when picking a supplement.
Yeah, for sure. Now, what about vitamin D? It's maybe not as sexy as all the other ones, but fundamentally very important.
Vitamin D is really pretty much the coolest one. That's to me, that can only be taken by IM shot, intramuscular shot, or under the tongue. Again, vitamin D, like all these other ones, do not work by ingesting by mouth. And the problem is that people think, oh, well, I live in Florida, I'm in the sun all the time. I mean, that's a misnomer. It's such a small amount. And I say 9 out of 10 of my patients that I check their vitamin D is low, beyond low. A normal range is 70 to 80. Most people are 20 to 30. So vitamin D is really important. I mean, it's great for your skin. It's great for antioxidants. It's just a great supplement for inflammatory issues. Again, it's considered something that we should have for this COVID crisis is normal vitamin D levels because it can help combat and help your immune system combat anything that comes along. So vitamin D is important, especially during flu season. I usually do some type of promotion to make people come in the store to get the vitamin D, even if I'm almost giving it away, because I know it makes such a big difference. So, all the supplements that we're talking about, if anybody gets anything out of this, these are maybe the 5 or 6 basic supplements that I would always recommend. And besides a multivitamin that has the essential FDA-approved ones, like I said, and as long as they're pharmaceutical grade supplements also, that's what we have to make sure we have is pharmaceutical grade supplements. So a company I like is Zymogen. They're a pharmaceutical grade that I use a lot. And I think it's important not only to pick the supplement, but pick the right company.
Before I ask you a question about vitamin D, how do I spell Zymogen?
Zymogen. Zymogen. Zymogen.
Okay, great.
No, I'm not promoting them. I'm just saying.
No.
I'm just giving an example of a pharmaceutical grade company.
Sure. Right. Yeah, I understand. Okay. Now, on the vitamin D, a couple of comments about that. Yes, in the studies that I was looking at about vitamin D many years ago, they showed a trend for people with the severity of the autoimmune inflammatory markers, like you mentioned earlier, CRP, ESR, and so forth, tended to be lower, corresponding to higher vitamin D levels. And so, an inverse proportional relationship there. So, and the guidelines that are generally recommended for autoimmune are to have vitamin D at the higher end of the normal range, not above and into potential toxic range, but just in the high end of normal range, not just average, but more than. Would you agree with that?
If you look at on a normal lab value, they'll say the normal value on one test that we have is 40 to 60. Now, to me, when I do all my lectures and any type of webinars I watch, they like the higher normal. So they like 80 to 90. So anybody out there that you're bringing up with autoimmune diseases that should be on the higher end, 80 to 90 is fine. Even if 1 to 100 is fine. Going overdosing on vitamin D could happen. It's hard to, but you should stay in that range. Too much of anything is not good either. But I do recommend a higher level of it.
Do you remember what unit of measurement that is?
I'm not sure. I mean, each lab has a different number.
That's right.
If I had it in front of me, I can see it, but I'd have to change screens.
Yeah, no, not to worry. Just especially with different countries. At vitamin D, it always seems to have different units of measurement in different countries, and it can get confusing. So that's why I was just asking there. But look,
I'll email it to you. So your next podcast, you can bring it up.
Okay. Yeah, fabulous. All right. When you see someone with inflammatory arthritis, such as rheumatoid or psoriatic arthritis or lupus and so forth, what would you do? Would you say, this is my recommendation from the menu and let's give you this IV? Or would you go through the process that you described earlier, which I didn't know about, which sounds very custom, and do a review of their blood work first and then match their deficiencies to a treatment?
I would do that. Usually if patients have, diseases where they're become debilitated or it's, affecting their lives so much, I would say, let's go ahead and go ahead of the norm. So I would get a full panel. I would get a CRP. I would get a allergy testing. I would get mold and fungus. I can't get those two words together. Mold and fungus to make sure it's not an environmental issue. And also, I'm big on being gluten-free for people that have autoimmune diseases. The GI tract itself is so inflammatory. Why cause more inflammation than you already have? Say you have rheumatoid, ankylosing spondylitis. Why cause more inflammation? So if you can decrease, your CRP by half, your symptoms would probably go down a lot.
Yeah.
So it's more of a balance, not just besides the vitamin C, high dose vitamin C IVs. I try to do a little bit more that I know of I'm not a rheumatologist, but I do know some things that might benefit some of these people. There's a mentor of mine that's in Colorado. She was an ER doctor, and she had extremely bad Crohn's disease, and she worked on relieving her Crohn's disease herself. And now she's extremely popular and famous functional medicine doctor, and she hasn't had a problem in her Crohn's since. And it was all IV therapy, immune function, gut health, anything GI tract we call gut health, and I've learned a lot from her. Her name is Jill. If anybody wants to look at it up, her name is Jill Carnahan, and she's extremely. I think she's great.
Yeah, fantastic. Do you have any patients' success stories with or without autoimmune conditions that you'd like to share? That it'd be nice to hear about some cases in particular that you like to treat. If you see someone walk in, they have a certain thing, you're like clapping your hands together, thinking this will be good because you can help them.
I had a patient with irritable bowel syndrome that had IBSD, which is IBS diarrhea instead of IBSC. And it took about a couple months and a lot of testing, stool testing and sensitivity testing, and totally changing someone's diet and high dose vitamin C for 6 months, once a week. And, it was hard because, it's a lot of hand holding because it's hard to believe that someone that can actually make a change. But after a couple months, you start seeing them walking into the office different, a little bit pep in their step, a little bit more color in their skin. And it's nice to see that, you can make a change. And these changes, sometimes are difficult because some people, it's hard for them to change their diet or change their lifestyle or exercise or lose weight. But when people walk in my door, I notice that they're committed. So they're walking in because they want to do something. So it's my job to, reinforce what they're trying to do, make them feel comfortable with the plan that we do, and make it a team approach. It's not just me saying, take these medications, take these supplements, and I'll see you in 3 weeks. It's more like, I keep in touch with them. We email, we talk to my front desk person if any problems. So that's the gratifying part about it is, you do see somebody like that. I had another patient that had pernicious anemia and didn't know it. And he was a normal person, and he lost 50 pounds. He could barely walk, getting divorced. It was just terrible. And he had an MTHFR issue where he wasn't breaking down homocysteine appropriately. And it was probably the highest I've ever seen. He had homocysteine level in the 90s. And we just pretty much put him on IVs and B complex and methylated folate. And probably 6 months he came back in, and he almost looks like a normal person. And he was very happy about it.
Now, what you just described is actually a condition of chronic B12 deficiency through malabsorption of B12, isn't it? Someone cannot absorb B12. I have a client who has that situation. So I was listening very intently as you just spoke. And I would encourage anyone to get in contact with you with that condition because that's very hard to resolve, isn't it?
It is. It's really not, because it's just a genetic test that you can get anywhere. It's called an MTHFR gene test. And it just tells you if you're homozygous, which means you have both genes from your parents, or you're heterozygous, which is one gene. So homozygous, you have more of a chance to have that disease where you have symptoms. I personally am heterozygous, where I have an MTHFR with just one gene. So I have a 30% reduction in my conversion of B12 from homocysteine. So I just take methylated folate and I'm fine. But people that are homozygous, you really have to make sure that they're ahead of it. One thing that people really don't notice is that women that have an MTHFR gene could break down estrogen inappropriately, and the estrogen could be broken down into, I think, 16 estradiol, which can cause cancer. So women should always be checked for MTHFR, especially if they have breast cancer in their family.
Okay, thanks for that. Before we sort of wrap up and do some sort of calls to action and how people might be able to get in contact with you, is there anything you'd like to add? Anything that excites you about where your clinic is going and where this sort of movement is heading, or anything that we haven't covered in here that's relevant to our discussion that should be added? Just in general, I think, like I striked on before, I don't think this is alternative medicine anymore. I think this is something that's going to be moving forward at an exponential pace. Already I'm opening up another office in Tampa and might be opening one in Cleveland. So it is a product that I think people can relate to because it kind of makes sense. I have a lot of customers that are repeat customers, and it's just,
they're so, most people come in and I'm so happy that there's some place like this around here for us. And that's a lot of what I get. And that's why some of my patients, they're just happy to be there. It's a relaxing environment, as you probably remember. And it's just, I think it's here to stay. And on the other hand, I just wanted to mention, because, I know everybody around the world, whoever listens to this, we're still in this COVID crisis. But I personally just want to make sure everybody knows that even though we're opening up, some states are opening up and we're trying to get back to normal soon, we can't get back to normal soon. Everybody has to realize that we have to prepare, and social distancing, washing hands, wearing masks in appropriate areas. We probably have to do that until fall or winter, only because, until we get a vaccine, because this is going to be here for a while and we can't let our guard down. So keeping our immune function up, keeping our antioxidant levels up, keeping hydrated, keeping our vitamin D and our zinc levels high. I think we have to do what's best for us so we can protect ourselves and our families. Because, I'm at the hospital all the time and, I'm taking care of COVID patients. And, I just got to protect myself and protect my family and do the right things. And I'm judicious about it. I'm very, my hands are probably going to fall off soon from washing them so much in the hospital.
Yeah, I'm sure they're dry from all the, breakdown of the fats. So thank you. I mean, that's it's really, insightful getting your point of view, being at the hospital all the time and seeing how you project this thing rolling out. So I just want to thank you for coming on this show and for sharing this information. And the differentiator, I think, that also with these things that we've discussed is the way that we can take these products. And I was actually surprised with some of the ineffectiveness that you talked about via the oral route for some of these supplements, especially the vitamin D. You have a product range, and this isn't a pitch, but simply just a making people aware that you have a product range of those 5 supplements that we talked about that can be appropriately absorbed by the body. Can you tell us how can people contact your office if they want to dial that in? I'm sure they can phone and have it delivered within the United States. And also, how can people get in contact with you if they wanted to do a telemedicine consultation?
My office manager, Olivia, she can answer all phone calls. She sets up my telemedicine. She'll set up any type of products that you guys need, and we can ship it out. And her number is 561-406-2202. Or if you want to go to our website is an info email that we answer regularly, and that's revitalive.com, REVITALIV.com. Revitaliv.com.
Yeah, okay, fabulous. Well done on all of the awesome work that you're doing. Thanks for taking the time to sit with me today for a little while and explain all this. It's been a pleasure to have you on the show.
My pleasure also. Be safe out there.